Hello, I am here with Summer, our acupuncturist at Vancouver Wellness Studio, and I am going to ask her about her approach to chronic pain. So, Summer, how do you approach chronic pain?
It's a good question. So, first of all, I always keep in mind that if there is pain, that means there's inflammation in the body. And that means that the inflammation is chronic and that chronic pain isn't going to go away overnight
Mm,
because it didn't appear overnight. Pain is a way for our body to tell us to stop or to slow down
mm,
because something we're doing isn't working. Right? So, illness, aches, pains are messages for our body just to pay attention to what's going on. And then when we ignore those messages, sometimes for like a couple days because we're really busy, or maybe sometimes for years, or maybe taking some medications, to kind of mask the pain so we can keep going. It can take time to get back in touch with those messages our body is giving us.
mm.
So, um, if we can make the right choices every day, that can change. But it's never as simple as one thing, right? It's all the things like it's the diet, it's how you sleep, it's how how do you go about your day? Do you go about your day in a panic? Like all of these things. So
Mm.
um, just trying to approach basically treating chronic pain from an idea of incorporating all the parts of our daily lives.
Mm. Yeah, yeah, I think it's just really clear to me when I've interviewed most of our team now, and it's not a simple answer. I think like what I hear in everyone's response around chronic pain is that it's multifaceted and it's a lot more complex than usually just one or two things. So thank you for articulating that so well. How are you seeing the impacts of COVID affecting your clients with chronic pain?
Yeah, so I feel like that has become a conversation with almost every visit. There is
Mm,
some aspect of COVID, I feel like, in every check in, whether it's feeling the stress of being unable to do what people want to travel, to see family, to go to work without feeling stressed, to have regular human interaction, and emotions play such an important role in our well being, as probably everybody knows, but sometimes we like to forget. So basically, I'm seeing them suffering because we want this return to normalcy. I want a return to normalcy, to do the things that we used to be able to do, right? And one of the biggest things I think that I see people are suffering from, at least, is also, I mean, in addition to emotional stress, but just that lack of touch, right? That human interaction, normal human interaction, not seeing somebody and then stepping 6 feet away from them because you're afraid you're too close to them, that fear. Um, and then we know people that have regular daily physical contact have less pain on average than those who do not. And so I know that on average, people aren't having that healing physical touch by friends, by family, um, so the health costs from COVID isolation are large, and I feel like they're getting bigger because we're not really seeing a lot of change in terms of that interaction and that touch and that being able to even just plan a family reunion, which can be very healing. Not healing for everybody, but um, I certainly could use a family reunion right now. Um, so stress is a huge factor with pain too, right? So in the acupuncture paradigm, we think about emotions. So like I talked about fear. It's like fear affects the kidneys, and like sadness affects the lungs, anger affects the liver. And in general, when we have stress in the body, it impedes its ability to circulate chi. And we say if the chi is not free flowing, there will be pain, right? So if you have chronic stress, you likely have some sort of chronic pain.
mm,
The idea is that in order to heal chronic pain, we also have to regulate and soothe the emotions. So
mm,
um, that's how I see COVID effect. Mostly, I feel like it's emotional,
mm.
and stress, and and human interaction and touch and lack thereof.
Mm, it's really hitting my heart. Thank you. Thank you for painting that broader picture. I think it's easy to forget, I think, just how much everything has changed. I think, I kind of, and I think a lot of other people, we've just adapted to this kind of new normal, especially a year in. And so even to just hear that articulated, I'm like, right. Yes.
Yeah.
Yes. What have been some of the most successful approaches you've used in lessening and preventing chronic pain?
Good question. Okay, so in general, acupuncture is really good at treating pain. It's kind of the one of the go-to things, like with massage or chiropractic. Like, I have pain. Like, okay, have I tried one of these three things, right?
Right.
Um, so the other thing that I've found with COVID that I've been really wanting to incorporate is a lot, like into every one of my treatments, is some sort of like touch, right? So like an acupuncturist can go through a treatment and put in needles without ever actually touching the patient.
Mm.
Um, so I've been trying to, whether it's like a neck massage or a few minutes of craniosacral or just a little myofascial on their arm because their wrist is hurting. I try to incorporate that into every treatment. So there is some like human touch and interaction. And I feel like it kind of bridges this gap where it feels more like there's this mental, emotional, physical, it brings it more together. So that's something like more recent. But so as I see, I think it also just in general, physical modalities like acupuncture and massage help to kind of break down like this rigidity, right? It's like you have this pain that defines you, but then when you start to have some touch and realize, oh, like I have lessened pain now, um, it can release aspects of these holding patterns. Um, yeah, and so that's kind of part of like the treatment part of how like I've kind of like lessened and reduced chronic pain, but preventing pain is really, I kind of was already talking about this and like how I see chronic pain being caused, which is we have to educate ourselves and our clients about how they got where they are.
Mm.
So a lot of times we go through with the client thinking about, well, how many times did you take ibuprofen so that you could work in the middle of a headache instead of just taking that afternoon off to recover and rest and listen to your body rather than kind of masking that pain? Because when we mask pain, what it does is we tell our body, like, shh, don't listen to that pain. Whereas the pain is telling us something is wrong, right?
Mm.
So then we slowly kind of get a little bit off balance, right? And then that becomes our new normal, our new balance.
Mm.
But we don't want that, right? We want to be out of pain. So once we already have pain and we feel imbalance in that pain, it's easier to take on more pain
Mm.
because it's like a radio, right? The radio has gotten really loud and we keep turning it down and turning it down and turning it down. So then we can't really hear any of our body telling us what we want. We can't hear it saying, no, we don't like that food, or like, no, when I work until 10 p.m., that doesn't feel good, right? It just all feels the same. So
Mm.
um, a lot of education, right? Like, oh, you have a big surgery coming up. Like, how much time are you taking off of work, right? Like,
Right.
on average, Americans take like a tenth of the time that, say, Europeans take off after a major surgery.
Wow.
What foods do you still eat, even though you don't feel well after eating them?
Yeah.
Um, how much time do you take for yourself every day just to relax and breathe? Um, and then how much are we listening to our bodies when something's starting to hurt? Things like that. So striving toward living a more balanced life is always a way to reduce stress and ultimately prevent pain.
Mm. Mm. Thank you. Um, what inspires you most about this work?
That's a good question because oftentimes it feels really challenging,
Yeah.
um, because we do see a lot of people in chronic pain and with multiple, health issues, and it can feel really trying because there can be financial constraints too, where they want to take that time off of work, but they can't, or they want to get another massage, but they can't, or
Yeah.
they want to eat the right foods, but it feels expensive, things like that. So sometimes it can be difficult, walking alongside this. Um, yeah. Basically, I think, seeing human resilience, seeing that we are dealing with a pandemic and we're surviving, seeing hope for the future. When there is lessened pain, people have hope, and then they see, oh, right, like I do have, my body can heal itself, right? Like I get sick and I can get better, right? Like I break a bone and I can get better. Like this is just another thing that needs to be balanced. So, seeing, um, seeing that we all experience pain. I'm not exempt. I have pain too, emotional pain, physical pain. Seeing that we're all like not that different. Like I often share actually sometimes with my clients my own personal pain experiences because I think it helps them to see like, oh yeah, like right, nobody is perfect. We're all human. We all have pain, right?
Yeah.
Um, and so I think also I'm often inspired by my clients to double down on myself and reminded myself to not neglect, my own self through helping others. Um,
Mm.
and I guess I also really, I really am inspired too, just working at this office at Vancouver Wellness Studio, because sometimes when I do feel like it's so hard, I'm surrounded by all these people who are persevering to, walk alongside people who are walking this difficult journey of chronic pain. And
Yeah.
um, yeah, so just being inspired by clients, coworkers.
Yeah.
Yeah.
Yeah, I so appreciate you talking about walking that line and that tension of, trying to find balance in an imbalanced system. And kind of like, life, the demands that are placed on us don't always allow for that balance. And at that same time, there are some things that we can do to support that inherent resiliency and inherent ability to heal. And yeah, I'm right there with you. I thank you for saying that. And I'm so inspired by our team too. I'm so grateful for this time to touch in with each of you and hear a little bit more about you and what drives you and inspires you. And um yeah, yeah, so lucky. I'm gonna ask one last question here. What do you feel is the most important thing for people to understand about chronic pain?
It's a good question. I think number one, that it's complex and it's multifactorial,
Mm.
right? There's never going to be one thing that resolves pain all at once, right? There's not even like one diet, one pill, one vitamin. I know sometimes people are always searching for that one, supplement or exercise routine or one health modality even, right? It's all the things.
Yeah.
So like we got to a state of chronic pain because of like the thousand tiny things that we have done every day over the last several years, 10 years, that make us who we are, right? So one time I heard a physical therapist talk about, you know, it's like someone bends over and their back seizes. And so they're like, oh, yeah, it's like I bent over and I pulled my back out. And he said, actually, it wasn't that one movement that pulled their back out. It was like the 500 tiny movements every day that they did that started to compromise all the musculature of their hips and their low back and their legs and their strength and their posture,
Yeah.
that eventually the back gave up, right?
Right.
So we kind of get to this point sometimes and we're like, wait, how did I get here?
Mhm.
Right? I used to be able to go run 5 miles and now I can't walk around the block. Like, what happened? Right?
Yeah.
And so we have to go back, I think, and remember, like, when we do find ourselves in a state of chronic pain, and we have to really be honest with ourselves and revisit our daily lives, right? If
Yeah.
we really want lasting change, I really think it's a mind shift, right? And it takes time,
Yeah.
sometimes years. Like, it took you years to get here. It doesn't have to be done all at once, but bit by bit, right? Like,
Right.
change one thing today, right? Until it becomes a habit, and then change another, and so on. So we have to make a habit of good health if we want to avoid cycles of chronic pain.
Mm. Truth. Truth. Yep. So much of that. And I think what really strikes me just in that too, that multifaceted piece of our bodies, whether, someone is working with, multiple practitioners here or just working with one, we're all aware of the multifaceted, contributions to our like dis-ease and our well-being. And I, yeah, I think it can be helpful to even just to hear that and know that and be reminded of that, that there are small things that we can do and it's going to take time, and getting support, whether it's from one practitioner or multiple practitioners or even, friends and family members that maybe want to make that change too, like that we're not alone, and I think that really struck me in one of your other responses was just the humanizing factor, right? Like we're all human, and there's no like perfect, like, we arrive to this perfect place of health. It's kind of an ongoing conversation.
Another one too, actually, just you saying that makes me remember, somebody said I don't remember who said it, but health is a journey,
Yeah.
not a destination. There's
Yeah.
never one point that you're going to arrive at perfect health and you're done and you don't have to continue to work on it anymore. It's always a constant journey forever.
Mm.
So,
Well, that is our time.
okay.
Thank you so much
Thanks,
for,
Crystal. It
yeah,
was fun.
you're great.
Okay.
If you enjoyed that conversation with Summer Bradley, our acupuncturist, and would like to learn more about her or all of our approaches, go ahead and go to vancouverwellnessstudio.com. We also offer a free 15-minute consultation with each of our practitioners. So if you want to get a little more information about how you specifically would be working with any of us or how we would want to work with you or where we'd like to start, just go ahead and give us a call. Thanks.